recommends all countries prescribe ARVs for longer periods of time, up to 6 months, while supply chains for all medicines are fully functioning. So far, 129 countries have adopted this policy. Similarly, shortages of condoms and pre-exposure prophylaxis can prove costly, and WHO calls for countries to ensure uninterrupted prevention, testing, and treatment services for HIV. Disruptions in access to life-saving commodities and services come at a critical moment as progress in the global response to HIV stalls. While COVID-19 will impact HIV services at the very least in the near term, we cannot pretend that everything was fully functioning before this pandemic swept across the world. Over the last 2 years, numbers of new HIV infections stabilized at 1.7 million annually, and there was only a modest reduction in AIDS-related deaths. More than 25 million people now have access to ARVs, but global targets for prevention, testing, and treatment are off target. Progress is were receiving antiretroviral therapy against a target of 1.4 million for 20. Progress towards the elimination of mother to child transmission has also plateaued. In 2019, an estimated 150,000 children were newly infected with HIV globally, and 95,000 died from HIV. The goal of zero new pediatric HIV infections is still far from reach. Going forward, access to services for children and other vulnerable groups must be expanded through stronger community engagement, improved service delivery, and tackling both stigma and discrimination. And like in any disease outbreak, we have seen that underfunded and overburdened health systems have a dramatic impact on other health issues. Immunization campaigns have been hit hard, risking resurgence in diseases like polio, measles, and rubella. Supply chain disruptions are impacting everything from the dispersal of bed nets to protect people from malaria to life-saving, nutritious food for children struggling with hunger. And above all, being kind to each other and supporting each other. I will be watching closely and look forward to hearing your recommendations. I thank you.